Welcome back to our series of lectures on the reproductive system. Today in lecture 2, we're going to talk about male accessory organs and the male physiology. Male physiology is pretty straightforward. When we get to the female physiology, brace yourself. So we look at the accessory organs of the reproductive system, and we think about the penis, which is necessary for copulation. And then external genitalia, that would be the scrotum and the penis. And remember that the penis has three parts. It has the root, the shaft or the body, and then the glans penis. Now, at the tip of the penis is the prepuce or foreskin. And this is some loose skin that covers the glans penis. This is what is cut off during circumcision. Studies have shown that males who are circumcised are healthier. They have fewer sexually transmitted diseases, and you see here 60% reduction in HIV risk. You stop and think about it. If you've got a covering in between the glans penis and the surface of the foreskin, there's that nice, moist, rich, warm area where bacteria would love to grow and fungus would love to grow. And so if a male is uncircumcised, they need to make sure that they are very meticulous about cleaning their penis, and especially get underneath the foreskin, pull it back, make sure that everything gets cleaned. With a circumcised penis, then you don't have to be quite as meticulous because it's going to get cleaned with regular washing. So when we look at the penis, remember it has two bodies of erectile tissue, the corpus spinosum, which surrounds the urethra, and then the corpora cavernosa. And corpora is the plural, and cavernosa is a plural. So this is paired erectile bodies, and it's called cavernosa because the tissue has caverns in it, has little caves in it, and this is where the blood flows in. And during an erection, the spongiosum and the cavernosa fill with blood, causing the penis to enlarge and become rigid. And then at the end of the corpora cavernosa, we have a little muscle. There's a little muscle called the cura, and it anchors the penis to the pubic arch. That would be very important. You don't want your penis to fall off. That would be very painful. So here we have this picture again, and I want you to look at the cross section and notice the corpora cavernosa and the corpus spongiosum, and notice that in the middle of the corpus spongiosum is going to be the spongy urethra. Now, when we look at the perineum, we have a male perineum and a female perineum, and this is really just surface anatomy. So this is the region between the pubic symphyses, the coccyx, and the ischial tuberosities. And it's from that area where the scrotum suspends and contains the root of the penis and the anus. And so when you look at this, find the pubic symphysis, the ischial tuberosities, the coccus, and then that diamond shape is what we call the perineum. Basically, this is just to give you some landmarks. So the accessory glands are very important. because they help keep the sperm alive and also contain chemicals to help the sperm get past the defenses of the vagina and the cervix. So the first gland is called the seminal gland, also known as the seminal vesicles. And they're going to be producing a viscous alkaline fluid. So it's what we mean by viscous. Well, it's kind of tacky. It's thick. It contains fructose, and that is energy for the sperm to make ATP, citric acid, coagulating enzyme, and prostaglandins. It has a yellow pigment in it, so it's got a yellowish color to it. And it's about 70% of the volume of the semen. So during ejaculation, the smooth muscle in the seminal vesicles contract and eject out this alkaline fluid. And remember, the duct of the seminal gland and the ampulla of the ductus deferens form the ejaculatory duct, and that's where this fluid mixes with the sperm and helps make up what we call semen, which would be the sperm plus all the fluids. Notice that this is an alkaline, and what that's going to do is going to buffer the acidity of the vaginal environment so that the sperm have an opportunity to survive and swim up into the uterus and then into the fallopian tubes. But first it has to get rid of the very acidic environment. The prostate gland is going to surround the urethra as it comes out of the bladder. And remember, we said that's the prostatic urethra. It's going to secrete this milky, slightly acid fluid, and this contains citrate enzymes and prostate-specific antigen, PSA. You may have heard of PSA as a way of testing whether or not a man has prostate cancer. They look at the PSA levels in his blood. It also, the enzymes help activate the sperm, and then when ejaculation takes place, then it enters into the urethra, this fluid, and it makes up about 1/3 of the volume. So you're looking at seminal fluid and prostatic fluid. So we look here again, pick out the ampulla of the ductus deferens, pick out the seminal gland, the ejaculatory duct, and the prostate. And you see where all this takes place. And then locate the bulbal urethral gland and duct. And you can see it is the very last gland right before the shaft, or actually right before the root of the penis. All right. So one of the problems that can take place is benign prostatic hyperplasia. And 2 out of 3 men, by the time that they hit about 60 to 70, will have prostate cancer. 80% of the men 70 and older will have this benign prostatic hyperplasia. So stop and think about what that word means. Benign is not cancerous. Prostatic, pertaining to the prostate. Hyperplasia, Remember, this means overgrowth of cells. Overgrowth of cells, so that the prostate cells proliferate and the prostate gland gets larger because of that. And what happens is that it starts to strangle the urethra, so it makes urination very, very difficult. Some men will have difficulty starting the urine stream, then they'll have difficulty stopping it. And if the bladder's not voided properly, then the urine can back up into the kidneys and start renal failure. So it's not something to really laugh about, because it can cause all kinds of damage. And this is why it's important that men get a yearly checkup, usually after the age of 40, to check their prostate and make sure that it's staying healthy. So prostatitis is inflammation of the prostate gland, and most of the time your GP can do the initial examination, and then you can go to a urologist when necessary. Notice that prostate cancer, right, says third most common cause of cancer death in males, and it affects 1 in 6 men in the United States. Digital exam screening is where the physician will use the forefinger or the middle finger inserted into the rectum to feel the prostate and make sure it's not lumpy, bumpy, and it's about the right size. We can also do blood tests to check PSA level, but you have to be careful because there are a lot of false positives. What happens is, if necessary, the prostate can be removed. Most men who have prostate cancer will also have radiation treatment. They're going to check the surrounding groin lymph nodes to see if the cancer has spread. Most of the time, prostate cancer is very, very slow growing. Not all the time, but most of the time. And sometimes it's just, the person is going to die of natural causes before the cancer spreads. So you may hear of men who just don't get treated. Also, age has something to do with that. After you're 75, 80, you may not want to have radiation treatment and get sick. Okay, the semen. We've already talked about that you have fluid from the seminal vesicle, you have fluid from the prostate, you have fluid from the bulbourethral gland, and usually that little bit of fluid from the bulbourethral gland helps to moisturize the tip of the penis, kind of make it slippery. So what we look at in an ejaculation is about anywhere from 2 to 5 milliliters per ejaculation, and anywhere from 20 to 150 milliliters of sperm per milliliter. So, you're looking at nearly 500 million sperm. That's just huge. That's huge. It's amazing. Wow, that's a lot of sperm, and it only takes one. It only takes one to fertilize the oocyte. So, men spend a lot of their energy making sperm. Remember that semen has fructose, and that's to help the little spermie make ATP. And it can protect, it will activate the sperm, and then what's going to happen is it's going to help the sperm get to where it needs to go. The alkaline fluid, as we said, is going to neutralize the acidity of the female vagina. It's going to neutralize the acidity of the male urethra, because that male urethra is going to have a few drops of urine in it. And then it also helps motility. So the prostaglandins are going to decrease the viscosity of the mucus in the cervix, and they stimulate the uterus to go into reverse peristalsis. And what this does is that the uterus will form a small vacuum that will suck the sperm up from the cervix into the uterus and help propel the sperm up into the fallopian tubes. It also contains the hormone relaxin, and that enhances sperm motility. Like we said, ATP for energy with the fructose. Some of the prostaglandins can suppress the immune response system, because remember, sperm are foreign cells, and the immune response system is going to say, invasion, alert, alert, intruder alert, and start attacking. And this is sometimes the reason for infertility with couples. There are antibiotics that destroy some of the normal bacteria that's found. And then there's a clotting factor that coagulates the semen in the beginning so that it stays put near the cervix. And then once reverse peristalsis begins, then fibrinolysin will start to break down that clot, and the sperm can then be sucked up and proceed their journey through the uterus to the uterine tubes, and hopefully, I guess, to find an oocyte, and kaboom! You were formed. So that's how you got made. Just saying. That's amazing. This is a good time to take a break, and let's talk about male physiology. So the male sexual response. It doesn't take much to get the human male an erection. It's just, especially when they're young and they're going through puberty, and sometimes just the wind blowing on their pants will, it's basically a reflex, and it can be very embarrassing. Baby boys will have erection. It's a reflex, especially to cold. So with the stimulation for erection, and with males, they're highly visual creatures. And so they can be stimulated into an erection by looking at something. Basically what happens is that the central nervous system activates the parasympathetic neurons, and these are going to cause a release of nitric oxide, NO. And nitric oxide is going to cause the relaxation of the vasculature in the smooth muscle. Okay. When that smooth muscle relaxes, the arterioles dilate and the corpora cavernosa expands. And as it expands, it starts to fill with the venous drainage, and that leads to the erectile tissues getting bigger, enlarging with blood, and that causes the enlargement and the stiffening of the penis. The corpus spinosum is going to keep the urethra open. That's really important, otherwise your sperm gets stuck. So I know that it says initial sexual stimuli such as touch, mechanical stimulation, erotic sights, sounds, smells, can also be induced by emotions, and it can also be inhibited, uh, especially under stress or strain. So when we look at this, but this is a reflex, but it can be controlled. Don't be surprised if your young teenage son has difficulties with control, but he will learn how to handle that. So once you have erection, and so the copulatory organ is enlarged and stiff enough, yes, then there's ejaculation. And ejaculation is basically orgasm in the male. And so remember that the sperm have been stored in the epididymis. They're going to flow from the epididymis to the ductus deferens. All right, and then the prostate and the seminal glands are going to contract. They're going to join with the little wad of sperm. This is now called semen. This is going to cause the bladder sphincter to constrict so that men don't urinate as they're ejaculating. This is really, really important. And you also don't want semen in the bladder. That's not good either. Okay? So when we look at what takes place, the bulbal spongiosus muscles are going to undergo a rapid series, and they actually expel the semen at about 10 to 11 miles an hour. Stop and think about that. You're going, that's not fast. Yeah, but if you're a little sperm, that's really, really fast. And like I said, ejaculation is orgasm or climax, and it will stimulate the pleasure centers in the brain, have increased heart rate and increased blood pressure. After ejaculation is a period called resolution, and this is where the musculature relaxes. There's a psychological relaxation, but it's a latent period, and so a male is not able to achieve another orgasm for a few minutes, and the older the male, the longer the refractory period. So it may last up to hours. What are some of the problems? You know, they advertise this. Do you have ED? ED, emergency department? No. Erectile dysfunction. A lot of times this is temporary, and it can be caused by stress, alcohol use, drug use, things like this. Basically what happens is that the parasympathetic nerves don't release enough nitric oxide and so the blood flow doesn't happen. There's not an erection. Notice it says it affects 50% of American men over 40. I think they're way too stressed out. But according to Hollywood, yeah, this never happens. What ED medicine does is basically it stimulates the release of nitrous oxide. A friend of mine calls it fix-a-flat. So when we look at this, with age, there could be atherosclerosis, varicose veins, sometimes a stroke. If you don't protect your penis, then you could have penile nerve damage. Sometimes diabetes can cause problems, and that's usually along with atherosclerosis. So, like I said before, the drugs just enhance the effect of the nitric oxide.